Osteoarthritis is the most common form of the joint disease arthritis, which affects millions of people around the world. This disease can impact a person's daily routine and, if left undiagnosed, can often get worse over time. Here we have fellowship-trained rheumatologist Dr. Taylor Mader with Baptist Medical Group to give us information on the effects of osteoarthritis and what treatments are available to combat the disease. Thanks for being here.
Thank you. Thank you for having me.
Well, and welcome to Pensacola.
Thank you.
Before we get started, just tell us a little bit about yourself and what led you to where you are and doing what you're doing.
Well, I just finished my rheumatology training at Medical University of South Carolina in Charleston, South Carolina. And I recently moved here to Pensacola a couple weeks ago to join Baptist Medical Group as a rheumatologist.
Oh, great, great. Well, like I said, welcome. Well, let's talk about osteoarthritis and just really what it means. Let's start off there.
Okay, so osteoarthritis is a very common joint disease. It typically affects middle-aged to elderly patients, and it's one of the leading causes of disability. It's caused by breakdown of cartilage. Cartilage is the cushion at the ends of bone, and it protects the joints. And when that is, when the cartilage is destroyed, you get bone on bone, which can cause enlargement of the bones, and you can get stretching of the tendons and ligaments, and that causes pain in the joints.
Well, now, how can this really impact daily living? What type of things would become a challenge, so to speak?
So typically patients present with pain. They can have stiffness, loss of flexibility, difficulty performing their activities of daily living, such as walking and gardening hobbies. And they can also have some swelling of the joints as well.
So how is this different from what people may think that, oh, I just can't get around as good as I used to because I'm getting older?
Well, some warning signs that this might not be osteoarthritis is if they're having warmth of the joints, any kind of redness, rash, fever, significant pain, severe pain. In that case, then they need to see a doctor, the primary care doctor, or go straight to a rheumatologist.
Are there things that people may have done earlier in life that may contribute to this? And if so, educate us, if you don't mind, please.
Yeah, there are some factors that put you at risk for developing osteoarthritis at an earlier age. Typically, symptoms start around age 40, but there's several factors that can increase the risk of it starting sooner. Obesity is a major risk factor. So losing weight is very important to slow the progression. Another factor is overuse or repetitive use or injury to a joint, any kind of previous joint injury. Heredity plays a factor. You can have osteoarthritis run in your family, and that usually affects your hands and causes bad arthritis in your hands. And then also joint deformity, such as like a leg length discrepancy if you have one leg longer than the other. Any kind of joint deformity like knock knees, bow legs, that can predispose you to developing osteoarthritis sooner.
Well, let's say someone is taking up some new sports activity, maybe they've retired or just want to stay active. Is this a conversation they should have with a doctor about what they're about to, a new program they're going to start, for example?
Any kind of new exercise program that somebody is about to start, they should probably consult their physician about before starting, especially if they have any underlying medical problems or comorbidities. But in general, exercise is good, but you just want to be careful if you have any other comorbidities.
Was there any preventative measures that people can take to try to avoid this?
Prevention, well, like I said, there's some factors that can predispose you. So weight loss is, the biggest prevention. For every 10 pounds of weight that you lose over 10 years, you can decrease your risk of knee osteoarthritis by half. Strengthening in your quadriceps or your thigh, that can help slow the progression of osteoarthritis and help improve pain. So those are preventative measures that you can take.
Well, let's say someone has developed the condition. What kind of treatment's available?
So unfortunately, we do not have a cure for osteoarthritis. There's no therapy we can give that will reverse osteoarthritis or completely take away your pain. But there are some options, such as in addition to weight loss and muscle strengthening, you can go see a physical therapist, you can see an occupational therapist, and they can help decide which exercise might be best for you. They can also help determine if you might need an assistive device, such as a cane or a walker. And then in terms of medical therapy, Usually first line we recommend acetaminophen, just over the counter. If that doesn't help, then you can try an anti-inflammatory such as ibuprofen. There's also some topical therapies. There's topical capsaicin, topical non-steroidal anti-inflammatories such as diclofenac, topical lidocaine. We can also give injections into the joint. And if the arthritis is refractory to all those therapies, then surgery might be an option.
Okay. Well, let's cover one more time. Tell us again about the symptoms. So if somebody's saying, maybe I'll need to look into this, what would they be noticing possibly?
So typically, patients complain of joint pain, stiffness, tenderness along the joint line, joint area. But if you're having severe pain or any kind of fever, rash, warmth, significant tenderness over the joint, then that's a different problem that needs to be evaluated by a doctor.
Okay. So if any of our viewers are concerned about this, what would you advise them to do?
So they can either go see their primary care doctor to be evaluated, or they can go straight to rheumatologist. They can come see me at Baptist, and I would be happy to see them.
Well, great. Well, thank you. Wonderful information. Thank you very much.